And rolling. Good afternoon, and welcome to the Thurston County Board of Health meeting for Tuesday, August 13th, 2019. I am the chair of the board, almost a clerk, John Hutchings, and to my right are you the vice chair?
Yes, sir.
It's been a minute. Commissioner Ty Menser, and to my left is Commissioner Gary Edwards, and Lydia Hodgkinson, the clerk of the board. And to her right, PHSS Department Director Shelley Slaughter, and Dr. Rachel Wood, our health officer. And to her right is County Manager Ramiro Chavez. And so welcome. I'm calling the meeting to order, and we're going to start with approval of the agenda.
Move to approve today's agenda, August 13, 2019.
Second.
Been moved and seconded to approve the agenda. Are any amendments or changes?
No, sir.
No.
Okay, all in favor say aye.
Aye.
Aye. We have an agenda. Same with the meeting minutes from June 11.
Move to approve meeting minutes from June 11, 2019.
Second.
Moved and seconded. Any changes to the minutes?
No, sir.
Nope. All right, all in favor say aye.
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 Aye. Done, thank you. Now we get right into proclamations and presentations. And the first one is National Breastfeeding Month. And we have Kateri.
Good afternoon, Commissioners. I'm Kateri Wimsett of the Division of Child, Family, and Community Wellness at Public Health. And today I'm really excited to talk with you about one of my favorite chronic disease prevention health topics, breastfeeding. August celebrates World Breastfeeding Week and is also nationally recognized as Breastfeeding Month. So today my colleagues Lori Montoya and Amelia Grube from the Nurse Family Partnership and I have a short presentation to tell you about breastfeeding in our community and then to ask for your consideration of a proclamation.
Good afternoon.
Good afternoon.
I'm Amelia. Okay, so first we're going to go over the benefits of breastfeeding that we know from research. Up on the screen you can see a chart that compares the ingredients of formula and breast milk. Research shows us that benefits to a baby include a heartier immune system, as well as lowering a baby's risk of having ear infections, asthma, childhood obesity, type 2 diabetes, childhood leukemia, and SIDS, sudden infant death syndrome. The benefits to a mom include a faster postpartum recovery as well as postpartum weight loss, as well as decreasing her risk for certain breast cancers and ovarian cancers, as long as type 2 diabetes and arthritis. We know there's a huge cost savings in that and that breastfeeding is mostly free, as well as helps with creating a bond between a mom and her baby. Lastly, the benefits to the community include babies being sick less often, meaning a baby is visiting the urgent care less often, and consequently, parents are missing work less often as well. And now I'll pass it over to Lori.
Hi,
Hello.
this is Abby.
That's
so
Abby?
now- Abby.
Abby.
Abigail. Yeah. So now that we've talked a little bit about the benefits to mom, baby, and the community, let's look a little bit at the statistics around breastfeeding. Can you guys see that okay?
We can see it, we just can't read it.
Okay, I'll read it for you. So,
It's in our packet, so.
Oh, it is in our packet, yeah.
So the American Pediatric Association recommends that moms exclusively breastfeed until the age of 6 months and then continue to breastfeed until baby's 12 months. So you can see here that the CDC reports that approximately 83% of women in the United States will initiate breastfeeding, but only 36% will continue breastfeeding until 12 months. In Washington State, we're actually doing really well. We're at 92% initiating breastfeeding, and then continue breastfeeding until 12 months, 48%. And then in Thurston County, within the Nurse Family Partnership Program itself, we're seeing 96% initiation, and then 68% continue to 12 months. So what do we do as Nurse Family Partnership? We basically go in and to support moms in breastfeeding. So we do a lot of work around preventative. So we're trying to provide a lot of education to moms, maybe thinking about things that they might encounter, some barriers, some challenges that may be common, and then also addressing things that maybe are specific for that particular family or mom. Some of the challenges that are listed up here might be breast infections, tongue ties, sometimes it's mental health issues or substance abuse or past traumas that can impact breastfeeding rates. And just like everything else, it's important to have a big variety and a lot of support in the community itself. So I'm going to let Kateri talk a little bit about the community resources that we have here in Thurston County to support breastfeeding.
So while we know that many women begin breastfeeding at birth, many stop earlier than they want to because of lack of support. And this year's theme for National Breastfeeding Month is Support Changes Everything. And I can tell you we're really fortunate here in Thurston County to have a really vital array of community partners that offer support for breastfeeding families here. Today I'm just going to highlight a few of these partners, but really there's quite a good network of organizations that support families and offer various resources. But one of those that I work with as part of my work with the health department is the South Sound Breastfeeding Network. And the SSBN, as it's commonly known, is a regional partnership of both business owners, parents, health professionals, and others that have been working together for over 20 years. Some of the things that the network do includes creating a regional breastfeeding resource guide, offering health provider educational conferences, supporting the World Breastfeeding Week events, such as a family picnic and a family photo event. That's what you'll see up there on the slide from last year's event. Another amazing partner that we work with is the La Leche League. And La Leche League is a worldwide organization that offers support to breastfeeding families for free. Here in Thurston County, they host a 24/7 text line to answer questions for parents. They also offer a monthly meeting to support breastfeeding families, and that's all done through the support of the regular wonderful families that volunteer for that service. Finally, another vital program partner is WIC, or the Women, Infants, and Children's Program, and their peer breastfeeding program serves women across the county and the region. And then one more resource that we're really lucky to have here that's kind of unique to our county is hosted by the Family Support Center, which is a weekly free chest and breastfeeding support group. And that's open to any family in Thurston County. It's every Thursday at 10 a.m. It is offered, we have a facilitator who speaks English and one who speaks Spanish. And again, that is done through a lot of various agencies working together, which is really a beautiful thing. I'm really fortunate today to have one of our partners here in the audience from Washington State Department of Health, Michelle Lord, but we have lots of folks who couldn't be here today because they're out doing the work.
Another way that we can support breastfeeding is Babies at Work initiative. So as you can see, there's a lot of benefits that come along with bringing baby to work. But I'm going to talk a little bit about how it personally affected my life. So Abigail has been able to use the pilot study that we do at Thurston County Public Health, and it has supported my family in many ways. So we're a military family. My husband is 100% disabled vet who was transitioning into the role of stay-at-home dad. So this program allowed us to kind of emotionally supported us through that. So transitioning can be really hard for service members when they're coming out. So this kind of eased our way into it, but then it also helped us financially. So thinking about childcare costs, it can be for an infant at about $1,000 a month. And then it also allowed me to come back to work sooner. So had I not been able to do that, it would have been months before I came back, and I was able to come back to work at 6 weeks. It was a big support for us in a place that we don't have family support here. So it really, in many ways, kind of engulfed us and helped to support us through that time. My daughter also was born with a structural abnormality, which puts her at risk for infections. So me being able to continue to breastfeed her was vital for her health as well. So it was invaluable to my family, and I appreciate you guys approving that pilot study. And my hope is that you guys will consider extending that out for other families. So, what can we do to support continued breastfeeding? As you heard today, it's a community role. And so the CDC says all sectors of society, families and friends, hospitals, healthcare offices, clinics, childcare facilities, community-based organizations, and workplaces can play a vital role in improving the health of families by supporting breastfeeding. To reach their breastfeeding goals, mothers need continuity of care, which is achieved by consistent, collaborative, and high-quality breastfeeding services and support.
So with that, today we'd like to ask you to consider our proclamation in front of you, but we also would be happy to answer any questions you may have.
Questions or comments?
I was going to ask, how did you find the cutest baby in Thurston County to bring to this thing?
I made
But
her.
it's yours.
I'll give my husband a little bit of credit.
Any questions or comments? Commissioner Edwards?
You've all heard me say this before, 30% of our population, but 100% of our future, and we can't do enough for these kids to get them off to the right start.
Well, in a personal story, I'm one of 9 kids, and we were all breastfed, not at the same time. And my husband transitioned, also a disabled veteran, transitioned about 5 years ago to being a stay-at-home dad. And so I appreciate the struggles that you and your family are going to endure. It's not easy. So thank you very much. And yes, we do have a proclamation to read.
Got it. All right. Whereas the mission of the United States Breastfeeding Committee is to improve the nation's health by working collaboratively to protect, promote, and support breastfeeding. And whereas USBC envisions breastfeeding as the norm for infant and young child feeding throughout the United States. And whereas breast milk is the preferred and most appropriate source of nutrition for infants, adapting over time to meet the changing needs of the growing infant. And whereas the act of breastfeeding builds a strong emotional connection between the mother and infant, a bond which lasts a lifetime. And whereas breastfeeding provides a safe, reliable, and renewable food source, especially critical during natural disaster and emergency situations. And whereas employers that provide workplace lactation support experience an impressive return on investment, including lower healthcare costs, absenteeism, and turnover rates, and improved morale, job satisfaction, and productivity. And whereas all major medical authorities recommend that mothers breastfeed exclusively for 6 months and continue breastfeeding for at least the first year of a child's life, yet breastfeeding rates continue to fall short of the nation Healthy People objectives. And whereas the Thurston County breastfeeding rate is lower than the state rate, and whereas U.S. Surgeon General Regina Benjamin has issued the Surgeon General's call to action to support breastfeeding, calling on healthcare providers, employers, insurers, policymakers, researchers, and the community at large to support mothers in reaching their personal breastfeeding goals. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims August as National Breastfeeding Month in furtherance of USBC's role to advance breastfeeding on our nation's agenda through collaboration, leadership, and advocacy so that all families will have the opportunity to breastfeed. Adopted this 13th day of August, 2019, Thurston County Board of Health.
So if you'll come up, we have a proclamation to hand to you and a photo to be taken.
Community partners that are here, we'd love to have you come out.
How old's Abby? Come on, get in.
Everybody squeeze in. Say cheese. Cheese. Got it. Thank you.
Keep up the good work.
That's always fun. And now we're, oh, wait, start again. That's always fun. And now we have a proclamation regarding Immunization Awareness Month. And that's been a hot topic.
Exactly.
Hi, Jeannie.
Commissioners, Thank you so much for
And
providing
this
us.
is Jeannie Knight.
I'm sorry,
That's-
it is. I'm Jeannie Knight with Disease Control and Prevention.
Thank you.
Thank you so much for providing us with this opportunity to be here this afternoon to support a proclamation for National Immunization Awareness Month. This annual observation highlights the importance of getting recommended vaccines throughout life. We have the power to protect ourselves and our families against serious diseases like whooping cough, measles, hepatitis A, cancers that are caused by human papillomavirus, and pneumonia with vaccines. This is certainly an excellent opportunity for us to encourage individuals to talk with their physicians, nurse, or other healthcare providers that they are in contact with to ensure that they and their families are up to date on recommended vaccines. As our children head back to school this fall, we need to make vaccinations at the top of our checklist. August is also a key time, and it's very important for us to make sure that adults as well are up to date on all the vaccines that they need to have to stay healthy. Vaccines are among the most cost-effective clinical preventive services. They prevent serious illness, hospitalizations, and death. They save us billions of dollars a year in direct healthcare costs and in indirect costs. However, despite our progress, we continue to see children and adults in Washington State and Thurston County who experience serious illness and, in some cases, even death each year from vaccine-preventable diseases. Many of the vaccine-preventable diseases are no longer common thanks to the vaccines that are out there. And while they're no longer common in the United States, the diseases still exist and can spread if people are not vaccinated. If we let ourselves become vulnerable by not vaccinating, a case that could touch off an outbreak of some disease that is currently considered to be under control is really only a plane's flight away for us. Vaccinations are certainly not just for protecting ourselves and are not just for today. They protect the people around us, some who cannot receive vaccines, some who may have failed to respond to a vaccine, and also individuals who are susceptible for other reasons. It may be something like they're immunocompromised. They also protect our children's children and their children by keeping diseases that we've almost defeated from making a comeback. It takes many, many Thurston County community partners to work together to provide access to vaccine and to increase our immunization rates in Thurston County. Some of our partners are here with us today, including Together, Camachin Middle School and the North Thurston School District, the Thurston County Medical Reserve Corps, and staff from Public Health's Housing, Investigation and Control of Disease programs, and our Emergency Response Program. And you will have a presentation shortly from the Medical Reserve Corps and our emergency response partners about some of the back-to-school clinic opportunities that they are providing to the community. Thank you.
Questions or comments?
Keep up the good work.
We're trying.
No? All right, thank you. Thank you very much. Oh, no, don't go anywhere. We have a proclamation.
I'm sorry.
That's all right.
I was just going to sit down and wait till you did this. Okay. I'll stand here.
Immunization Awareness Month. Whereas Immunization Awareness Month highlights the important role vaccines play in preventing serious, sometimes deadly diseases across the lifespan. And whereas vaccines are one of the greatest achievements of the past century in protecting the public's health, dramatically reducing the number of deaths from preventable diseases, and increasing overall life expectancy. And whereas nationally, for every birth cohort of children receiving the recommended vaccines, there are 33,000 lives saved, 14 million cases of disease prevented, and $9.9 billion in direct health care costs saved. And whereas when people are unvaccinated, outbreaks of diseases like pertussis, whooping cough, and measles can and do occur that not only impact health, but also the ability of children to attend school and adults to go to work, return. And whereas every year between 50,000 and 90,000 adults in the United States die from vaccine-preventable diseases, and whereas diseases are never truly gone, and communities must remain over 90% immune to continue being protected. And whereas by maintaining high vaccination rates, we not only protect ourselves, but we also protect vulnerable infants who are not fully vaccinated yet, and people of all ages with weakened or failing immune systems. And whereas immunization rates in Thurston County are below the level needed for our community to be protected from diseases, with only 57% of young children aged 19 to 35 months old having received the recommended vaccinations. And whereas our county government promotes immunization awareness, along with state and national organizations such as the World Health Organization and the Centers for Disease Control and Prevention, and encourages people of all ages to discuss vaccination with a healthcare provider and to get any needed immunizations. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims August Immunization Awareness Month and encourages all community members to recognize the importance of vaccinations for people of all ages in every community across the country, to reflect on the progress of science and medicine in the eradication of contagious disease, and for all residents to do their part to help maintain the health of our community by staying up to date on immunizations. Adopted this 13th day of August, 2019, Thurston County Board of Health.
Yeah.
Go vaccinate.
And now we have copies.
And there's
We can bring everybody up that needs to come up.
partners here.
Thank you.
Here we go. Thank you. Thank you.
Do you want it?
We ready? All right, now we're at the point of agenda item number 3, rather, opportunity for the public to address the Board of Health. Is there anybody that has signed in to address the Board of Health? Anyone? 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 Nobody, okay. Thank you, Romero. Agenda item number 4, department items. We're now moving to a presentation, 2019 Back to School Clinics. Jennifer Dixon.
Right, hello, good afternoon. So I'm just going to tell you a little bit about our clinics that we have. I work at Public Health within our Emergency Preparedness and Response Department, but also coordinate our Medical Reserve Corps. So our clinics that we have 3 main back-to-school clinics that we do each year. This year, they are on August 15th, August 22nd, and September 21st. And I know there's a flyer in your packet that kind of lays out when those dates are and where they're at. But those clinics, we but the way we use those clinics is to exercise our point of dispensing plan, which is a core emergency preparedness capability. So our ability to be able to distribute, whether it's medication or vaccinations, but in the event of an emergency, to a large group of our population. So that's why we bring in the Medical Reserve Corps and we coordinate. We can use those clinics as a way to do that, but also work with our community partners, which is a critical function in the event of an emergency, having those relationships prior to something actually happening. And then, in the meantime, we're able to provide a community service as well. So I did bring in some of our community partners, and they're going to tell you a little bit about, from their perspective, about the clinics and what they do and how they impact the community. We do have one partner that's not here today, but I wanted to mention them. So Kaiser Permanente, our Olympia Medical Center, they open up a whole wing of their clinic on a Saturday when they're normally not even open, for us to come in, do a clinic, see patients that aren't even Kaiser members. So we still wanted to acknowledge them and thank them for their support in the annual clinics that we have. So first up, we have Jennifer Gould. She's with Community Schools Coordinator with Together. She works us to coordinate the clinic that this year will be on August 22nd at Peter G. Schmidt Elementary in Tumwater. And it's an event that they call Back to Basics, immunizations and more. So they also do some other community events around back to school. So I'll have her come up and talk a little bit.
I did bring flyers. I don't think it's in your packet, but they are available if you would like to have it.
Okay.
Okay. Hi, I'm Jennifer Gould. I'm a community schools coordinator, and I'm just honored to be here today, so thank you. I have to start with a little bit of the journey of how we got here. I think it tells the story well. Over 5 years ago, Together set out on a collective impact journey in partnership with the Tumwater School District to implement a program called Community Schools. The mission of community schools is to reduce barriers and increase engagement opportunities for families and youth from within the school. During that first year in 2014, the need for increased connection to medical care was evident. Our coordinators spent a great amount of time connecting and walking families through resources around healthcare. Because of these needs, we began to brainstorm about how do we streamline opportunities for families and use the same school hub model. In the summer of 2015, we launched the first Back to Basics in partnership with the Thurston County Medical Reserve Corps. And over the past 5 years, yes, we've been doing this for 5 years now, it's become a staple in our school community. It's a school readiness event that everybody looks forward to and supports. I've watched the immunization clinic grow in numbers. The first year we had 30 families. Last year we had 120 families.
Jeez.
We'll see what we have next week. Back to Basics is about creating a hub of healthcare and opportunities all in one venue. These events are hosted in school buildings, on bus lines, and in places that are familiar to our families. We think of the immunization clinic as the hub, as the main event. Everything else we get to do is the icing on the cake. We bring in services to families during that event. We have a healthcare navigator on site. We provide school supplies. We have after-school opportunity engagement information for families, back-to-school haircuts. We have housing resources, early learning opportunities. This year, we are offering transportation to the families in our rural Tumwater community so they can attend without barriers. The intent is to create a community network for families. We want families connected, just like we want our kids connected in schools. We strongly value a family voice at these events and take the opportunity to ask families, what services are we missing? How can we do this better for you? We also ask them if they would like further connection with a coordinator. These questions allow us to shape the event for the next year, Last year, we had 25 families seeking additional support from this event. This year, we're going to have the asks of those 25 families available at the event. Back to Basics is an avenue of creating healthy, connected, and a thriving community. Lastly, I want to thank the Tumwater School District, leadership, and health and wellness teams who partner with us together to transform schools into clinics. It's an incredible feat. I also want to thank the Thurston County Medical Reserve Corps volunteers. They are amazing. Every year I look forward to seeing them, to partnering with them. Thank you for the opportunity to celebrate our journey of creating healthy communities together.
Then we also have with us Leslie Van Lieshout. She's the Director of Student Support with Thurston, North Thurston Public Schools, and helps coordinate the event that we do that will be this Thursday at Camacha Middle School. So she'll talk a little about that.
Hello, and thank you so much for asking me to come. The North Thurston Public Schools has long been a school district about the people that live in that school district, but we have partnered with many people in the community. The Little Red Schoolhouse Project has been at Camacha Middle School for several years. They've been around for 28. They used to be in Tumwater School District, and I work with them on their board. And I asked them about having a immunization clinic to get school, not only school supplies and coats and all the things that kids need to start school, but also the immunizations, which are critical. I oversee nursing at the school district, and I know exactly what the immunization numbers look like, and I get the call when there's a problem. So it was very important to me and to our community. And we did know when I began talking to the Medical Reserve Corps, I had no idea how it would look. This will be the third year, and we are serving a lot of families. 200 last year, I think, and it was a pretty amazing group. And some of those families are brand new. They just came to this country. They just came to this state. Some of them need 5 or 7 immunizations, and the cost of those would be astronomical. They couldn't do it without this wonderful work of the Medical Reserve Corps. At the North Thurston Public Schools, we're working to have a family youth resource center that will open in just a couple of weeks, I think. Keep your eye on it. There's an open house in October that we'll be sure to invite you to. It's going to be a place where families can come to get all the resources they need. They will be able to get coats and clothes and shoes and school supplies, and we have a food hub there from the Thurston County Food Bank. They'll be able to get the resources of our homeless navigator, if they're foster care, social and emotional learning people will be there, military support will be there. It's going to be pretty exciting, and this is just another piece of the puzzle, and the Medical Reserve Corps is amazing. The Little Red Schoolhouse Project, all of those people are completely voluntary. There's no overhead whatsoever, no executive director, no anybody. It's a small group of board people who volunteer their time, and they spend every cent they get on kids. And it's just an absolute joy to work with all these different community partners in helping kids to be immunized, ready for school, and to be able to move forward. We have ours really early so that if they have to get a second immunization dose, they can do it before the immunization clinics get over with. So it's very great to be able to have every family come who needs immunizations. And thank you so much for supporting immunizations in the county.
So again, we want to thank Jennifer, Leslie, their organizations for their work, their collaboration each year. And as you can see, not only is it the immunization clinics, that's what we talk a lot about, because that's where our effort as the Medical Reserve Corps goes into, but there's a lot of other resources and benefit to our community through the work that's done. Did any of you have any questions?
Questions or comments or statistics?
Just want to thank you for all the work you do.
Commissioner Messer?
No questions. It's a great group of organizations. I'm proud to have Thurston County's logo. I'm looking at your sheet, of the summary, and the Medical Reserve Corps. I've said many times, I didn't know about them before I became a commissioner. And I'm just always stunned, really, at the expertise and the volunteers their time to help the community, and to have the school districts together, and Kaiser is great as a great team. So thank you for doing this. Pulling this all together.
And North Thurston, Leslie, North Thurston Public Schools, thank you very much for all your collaboration and work that you do. And yay Camacha, because my grandson goes to Camacha and he's got some other siblings that'll follow him. And Jennifer together is an outstanding organization with Megan Darrow and her sister Megan Goldenberger. So thank you very much for all you do with back to school clinics. You bet. Thank you.
Thank you.
Next, oh, yay. I figured we already did that, I'm sorry. Department item number 5 is kindergarten readiness. Liz Davis.
Hello,
Liz.
Commissioners. Liz Davis. I'm the Division Director of Child, Family, and Community Wellness at Thurston County Public Health and Social Services. We are just a few weeks away from the start of the school year, and many kids are getting very excited about their very first day of kindergarten. Commissioner Mincer, as you know, as your wife is a kindergarten teacher. But we know that learning doesn't start in kindergarten. It starts long before that. And brain science tells us that our experiences very, very early in life are essential for healthy development. At the beginning of every school year, all kindergarten teachers in Washington observe children in their classes in everyday classroom activities and then assess them in 6 different domains. This is part of the statewide WAKIDS assessment, which stands for the Washington Inventory of Developing Skills. So you have handouts in your packet that are in both English and Spanish that describe this assessment further. It helps teachers to find out what each child knows and can do at the beginning of the school year. And those 6 domains are social emotional, things like learning to share, language, things like following directions, literacy, being able to identify short words, physical, getting better at movement like running or jumping, cognitive, being able to start sustaining attention on topics that interest them, and math, things like being able to count to 10. Readiness for kindergarten is defined as being able to demonstrate the skills expected of a 5-year-old in all 6 of those areas. But sadly, as I've shared with you before, only 50% of children in Thurston County are considered by this assessment ready for kindergarten. And that is the same as the state average. Sadly, some of our school districts in Thurston County have as little as 24% of kids entering kindergarten with those skills expected of 5-year-olds. We know that investing in early learning works. The Nurse-Family Partnership at Thurston County Public Health and Social Services is one of the most effective evidence-based ways that we can help infants and toddlers get a great start in life. You've seen a lot of our NFP nurses here today. And there are other many wonderful programs and organizations here in Thurston County that do amazing work to not only help children be ready for kindergarten, but also for learning in life beyond that. So I'm delighted to introduce 2 community advocates to talk to you today about learning and kindergarten readiness. Jennifer Williamson Forster is the Executive Director of the South Sound Reading Foundation, and Gary Burris is the Executive Director of the Child Care Action Council. So I will turn it over to Jen to start with.
I'm not that tall. Thank you, Liz, and thank you, commissioners and everybody here today. I know a lot of faces around the room, and I don't have my name badge on. Sorry, Cynthia. She's on my board. Can hear about that. Again, I'm Jennifer Williamson Forster. I've been Executive Director of the South Sound Reading Foundation. It's been a privilege to serve that organization for over 13 years now. And I'm really glad to have this opportunity to reflect on kindergarten readiness, which is why I took this job to begin with, and what we do at the South Sound Reading Foundation. By now, we all know that healthy brain development and early learning are essential for a child to succeed in kindergarten, in school, and in life. And reading is key to that. Children who have not developed some basic literary skills by the time they literacy skills, sorry, not literary, by the time they enter kindergarten are 3 to 4 times more likely to drop out of school. Another statistic that I don't have written down, but I have memorized, and I chant it when I go to sleep at night, is 2/3 of all children who are not reading proficiently entering 4th grade will end up in jail or on welfare. And the reason, 85% of school content is delivered through the written word. So you could be a genius in math or science, but if you can't read or you can't read well, you're going to struggle. So in order to succeed in kindergarten and beyond, children need a solid early learning and literacy foundation. And while early learning programs, and I want to emphasize this, early learning programs are very, very important, and I'm not discounting those. Parents are our child's first and most important teachers. And home is where a child begins to create the building blocks of language and literacy and learning. Child development experts have learned that from birth, children are goal-directed to experiment and learn from experience. Parents can provide those experiences to help their children build strong foundations, or not. And I've seen both a lot in my 13 years, and I've worked with a lot of community partners who deal with that regularly, including Nurse Family Partnership. So this is why we at the Reading Foundation are out in our community talking and gently, ever so gently educating families about the importance of reading and engaging with their children. We also provide reading engagement activities and free books for kids, which is what we're most known for, getting books to kids. But education, family education, is the foundation of our foundation. So I really want to talk real quickly about what we do when we talk to parents. So when we're talking to parents about reading, we're talking about 3 really key factors. One is healthy brain development, one is school readiness, and one is family bonding. So healthy brain development, I love this analogy, and I love it when I hear from parents that I've talked to 5 or 6 years ago that remember this talk, because I haven't changed it much apparently. But I talk about kids who come from literacy and language poor environments. They do CAT scans on these. They've done a CAT scan or 2 on these kids, and they literally show like this brain stem that's kind of like a stump, that's a snarled stump, and it has a few of these little squiggly branch-like branches. And then they show a CAT scan of a child who's been in a literacy and reading-rich environment, and it literally looks like a tree inside their brain. Every time we read with our kids, we engage, we talk, and our kids are in that safe, warm place. Every time they hear a word and they associate a meaning with that word, or they see an image and they associate a meaning with that image, they create that synaptic connection, and that's what creates those trees. So in language and literacy-rich environments, those kids are building all the skills they need to succeed in school. So that's healthy brain development. Reading to children literally wires brain cells together, creating networks that facilitate independent reading and independent learning. I also share with parents why reading is so important for kindergarten readiness. And you just think about it, you don't even realize it. When you're reading with a kid, they're getting to understand how books work if you have a book. So, I mean, front to back. But they're also understanding left to right, up to down. A lot of kids who don't have that enter kindergarten without those skills. They understand how to follow a story. They get letter and phonetic awareness, increased vocabulary, and most important for me, a motivation to read, a curiosity, just a natural curiosity to want to learn. So finally, I think probably the most important thing I do when I talk to parents about reading and engaging with their kids is family bonding. And we talked a lot about this with child and youth resiliency. The best tool, and it's like, if you don't remember anything else, I tell them, remember this. The best tool, the best toy to develop a child's brain is a loving human. What wires a child's brain is repeated experiences in which they are actively engaged again with a loving, caring human. Reading every day is key. When we read regularly with our kids, we develop strong relationships with them. So I tell them to take time, and I tell them to be 100% present and read with their kids and make reading part of a daily routine. Fill their homes with books, which of course we have bins and bins of, so they're welcome to take them. Incorporate reading into every activity and to be a reading role model. A loving, responsive, caring parent, one who reads and engages with their child regularly, is essential for healthy brain development and early learning. And healthy brain development and early learning are the building blocks for kindergarten readiness and success in school. And that's what we're trying to do at the Reading Foundation.
Wow.
Thank you so much for having me here today. I'm Gary Burris, Executive Director of the Child Care Action Council. We're a Thurston County-based nonprofit, been around for about 30 years. We serve Thurston, Grace Harbor, all the way up the peninsula, 6 counties. I'm part of a child care aware network that serves the whole state. And I'm going to talk to you a little bit about child care generally and a lot about what we do. So child care is a key workforce support. Sometimes people don't necessarily think about that part of the role of child care, but if you have a sick child, or if your child care falls through, you can't go to work often. So the U.S. Chamber of Commerce in 2017, recognizing the importance of child care both for the current workforce as well as the kids who are going to be the upcoming workforce, issued a report. And it's called The Workforce of Today, Workforce of Tomorrow. Based on that report and other interests of the business community, our state developed a task force. Michael Cade from the EDC has been part of that task force for the past year or so, trying to think about how we can involve the business community in finding solutions to support the workforce and getting high-quality child care. So the Child Care Action Council, most of our work is with those child care workers, with the workforce, people in licensed centers and people who own a home who have a licensed family home child care. And our biggest program is called Early Achievers. It's a quality improvement program. Basically, our staff go in as coaches. They look at the environment. They look at the interactions between the person providing the care and the children. And they look at, what toys are there, what activities are happening, and they put in place quality improvement plans with the teachers and with the family home owners. At some point, a rating happens with the University of Washington, coming down, looking at the facility, looking at the interactions, and then a continuous quality cycle occurs, and new plans are put in place, new improvements are put in place. In addition, we offer professional development to the workforce. So here in Olympia, throughout the region, we offer really high-quality training that's relevant to the job and the everyday work that the child care workforce does. You may say, well, what's the difference between child care and babysitting or just watching a child? Well, I think Jennifer described it really well, right? Those interactions where you're with the child, you're reading the child, the brain develops. If you're handing them your phone to entertain them for an hour or two, probably not the same brain development that's occurring with the interactions. Play-based interactions are one of the best ways for kids to learn. High-quality child care workforce does that. The other thing that we've embarked on just this year is to offer the state preschool program in North Thurston. So we've partnered with the North Thurston district. We're going to have 72 spaces available for 3- and 4-year-olds. We're looking to expand that. North Thurston would like to add additional sites in the future. So this is our first venture into offering that state preschool program. It's called ECAP. So we're very excited about doing that. We've also partnered with the districts on kindergarten transition, helping child care providers connect with the schools, helping parents to understand the enrollment process, getting the people at the right place at the right time to enroll for kindergarten, those sorts of things. And we've done some shared professional development between the child care and the K-12 workforce. So there's some key challenges right now in child care. Child care is one of those businesses that's really hard to make much of a profit, and the workforce is paid very low wages. So if you have an interest in having a high-quality child care system, there's probably going to be additional work at the legislature to support funding for high-quality child care, to support that workforce, to support facility funds, other kinds of things. And then beyond the child care workforce, we do work also with parents and with kids. So a couple of programs I'll highlight. We have a Raising a Reader program. Basically, it's about 1,200 kids in 42 sites. About half of those are in Thurston County. We focus on lower income neighborhoods and the Head Start and the ECAP program so that we can get books into the hands of children and their families who might not otherwise have access to a lot of books in their home. And we rotate the books every week during the school year, so kids take books home. We find that parents become very engaged in the program. The percentage that are reading and sharing books goes way up, as well as children's vocabulary goes way up. So that's a really great program that we have. And then we also have what are called Play and Learn groups. We offer those at St. Peter Hospital and at the Family Support Center. So some kids are at home with a parent, with a grandparent, with a neighbor, and this is a chance for the parent, the caregiver, to come together with the child. The kids play, the parents, caregivers learn about child development, what's appropriate child development for a certain age, help get the kids to services if they have a delay in their development, but also to give a chance for the parents to network with each other and sort of develop a support network. So I think that's what I have, and appreciate your time.
Well, thank you.
Do you have any questions or comments for either Jennifer or Gary?
Our future depends on it. Keep it up.
Let me go to Commissioner Menser first. Anything?
No, that was great information, thank you. The handout you gave on WA Kids is really, you mentioned my wife's kindergarten teacher, and she was just becoming full-time at the time that WA Kids got put in place. So in addition to trying to figure out a new school and a new place and a new job and new colleagues and administration, she had to learn how to do WA Kids assessment. So WA Kids was a bad word in my house for a couple of years, but over time, she's really come to see, or she's really bought into how important it's a really good system, and all the teachers got, they got trained and got used to how to do it and make it, and do the assessments, because it's a little tricky.
Yeah,
I was
it's
trying to
very
help her with
challenging.
some of the materials when she was juggling all of that, and you go to a multi-day training that I think she went in Bremerton, and so anyway, it's pretty intensive, and I think it was kind of cutting edge for Washington to sort of be on the leading edge of that, recognizing how important the statistics about how your whole educational success is so dependent on a successful kindergarten year is really scary. Encouraging, but scary, but it's good. We can focus our attention on it, and glad you guys are doing that.
Dr. Wood.
Yes, I wondered how much work you do with libraries and school librarians. I just have such fond memories of what Timberland Library did for my kids in the summer, and also the school librarian at McLean Elementary, who was amazing.
So Jennifer, come up here. We need you to be
You
on
got to
the
come up
mic.
to the microphone, Jennifer.
Thank you for the Reading Foundation. We partner that actually we were founded by the schools and the libraries and the Head Start. So we are regularly partnering with the schools to get books to the kids. We actually serve over 1,000 kids a week with free books, and library too. The library is one of our best and biggest partners. So when we're out in the community, we go to the Boys and Girls Club, after-school programs, early learning centers, and we do programming and provide free books. But we also bring community partner information with us. So we'll have stuff from Child Care Action Council, we'll have stuff from the libraries, and the library stuff goes really fast. No offense, Gary, your stuff goes fast too. Near and dear, and we have a book van, and so we get that a lot. So we go out to we'll follow the food bank around in the summer, and the food bank, you guys I'm sure are aware that the food bank has their free lunch program, and then we tag along once or twice a week with our book van. And people say that remember the bookmobile as a kid, that reminds them of the bookmobile. So thank you for letting me talk about that.
One of my favorite activities, did you have somebody to respond to that, Gary?
Yeah, just quickly. So one of the things throughout the region, Timberland Library staff are very active in what are called early learning coalitions to develop partnerships between all the various supports for kids and families and coordinate. And then as part of our Raising a Reader program, at the end of the year, we do our celebrations at the local regional libraries and encourage the families to get a library card with their kids.
One of my favorite activities as a dad was reading to our kids. And as you can imagine, it was wild and crazy and not read exactly how it was written. But man, it was a hoot. And to see my kids reading to their kids is equally fun, because they just get really animated and just make it fun. But like you were saying, Jennifer, the kids with their word association and the way they learn is canny. In 2011, I was diagnosed with some type of a cancer. It's gone now. But my daughter-in-law, just after finding out, was going through a drive-through coffee stand telling the barista, hey, my father-in-law has CANCER, because her 5-year-old's in the back of the van. And he says, Opa has cancer?
Oh, no.
And she just about dropped her coffee. But that's attributed to reading and engaging with your children. It's that human connection, that tool.
I do want
Can't be overstated.
Yeah, I want to say too, it's really exciting because I get the opportunity to talk to moms in recovery about reading, and it's a 2-hour, it's pretty intense, and I do it once every other month. And sometimes I get to remind those moms that when they were their kids, their parents read to them, and they went on their own journey and kind of forgot, and then they get to re-engage with that with their kids. And it's super special because you've just flipped a family back into that.
Yep.
So, yeah.
That's so fun. It is so fun. Thank you very, very much. Thank you. Now that takes us to department item number 6, Thurston County homelessness update with Keely Marino. Yay, Keely.
Good afternoon. I'm Keely Marino with Public Health and Social Services, Thurston County's Homeless Prevention and Affordable Housing Coordinator. Good afternoon. So mouthy, so many words.
Yep.
First of all, I just want to remind everyone in the room that at this point it's been pretty firmly established that unsheltered individuals across the county number anywhere between 800 and 1,000 individuals or families that are not in homes that are sleeping in unmanaged encampments, and that our county does have 357 shelter beds of various kinds. They're all full. So when I talk about the hazardous weather task force and some of the activities that we've been engaged in, just holding that kind of picture in your mind of some of the changes that we've made in how we deliver services. So as everyone knows, perhaps, or maybe many don't know, the Hazardous Weather Task Force came into fruition in 2017 for the 2017-2018 cold weather season, engaging with stakeholders in the community, including the 3 contracted shelter providers that provide shelter for youth, young adults, families, and single adults. So that's Community Youth Services and Family Support Center and Salvation Army. Prior to 2017, all of the cold weather days for extraordinary weather events were determined by a static temperature. So it would be 32 degrees predicted for the evening. There'd be an email that'd be sent out. We'd have cold weather for that night. 2017, we turned it into a season. So from November 1 until the end of March, those 3 shelters are contracted to provide extra capacity the entire season. So we increased the contract funds that we were able to give to them. And then other agencies that provide shelter that are not contracted through the county also stepped up. So that would be Union Gospel Mission, going from about 50 beds to about 80 during the cold weather season. And then also the Catholic Church's Sacred Heart and St. Mike's provide 12 beds for our gentlemen who are experiencing homelessness during the winter. Well, this year we started talking again about how last year in August, there were at least a week or more where the air quality due to smoke and fire was so bad, and we didn't really have anything in place to respond to it as a task force. We were pretty just set on the cold weather response. So backing up a little bit, in February 2019, you'll remember the 12-day snow storm that we had, and we were able to declare through Director Shelley Slaughter was able to declare a Code Blue event. We provided extra capacity beyond our extra capacity that we already have set for the winter. During that time, we realized that there were many folks in the unmanaged encampments who weren't willing to leave their belongings or their tent or their loved one or their pet and come into a pop-up shelter. And so in order to provide something to keep them safe, we operated for the first time a shelter-in-place model where one organization really stepped up, that's Partners in Prevention Education, stepped up to organize volunteers alongside Intercity Transit to either provide transportation for folks sheltering in place to shelters or to bring survival goods to those people to basically just keep them alive. That was very successful. City of Olympia participated as volunteers. Community Youth Services went around in vans and distributed survival gear. So as we were talking about this potential for smoke and fire this summer, and it was predicted that this would be even worse than last year, so far better, but it's still early on in the season. We discussed with the sheltering folks that we contract with, what are we going to do to be prepared for smoke and fire this year, because it's inevitably most likely going to happen. So we discussed we would be able to start talking about how to do shelter-in-place activities for folks that are in unmanaged encampments during smoke and fire, and what that might look like. I met with Public Health Officer Dr. Wood and some teams from Public Health and Social Services to discuss poor air quality. What does that mean? What are the thresholds? How do we declare that for some kind of Code Blue sort of activity within the Hazardous Weather Task Force so that we can either expand capacity of our shelters during those events as well as the cold weather events. So after meeting with the shelter providers and with the other organizations that provide shelter-in-place activities, we decided that this year we would, instead of having the contract start for shelters on November 1 and go till the end of March, that we would make it an annual contract. That way, if for some reason there is a smoke and fire issue that happens in this last part of summer, early part of fall, those shelters will be able to open up their capacity, expand their capacity to keep more people inside at night, that we will be able to provide contracted through another agency in Olympia, sheltering in place activities by distributing water or other items that might be helpful for people who are out in unmanaged encampments. And then Interfaith Works would receive some funds that if they were to expand their staffing model on a Saturday when it's not normally open, we'd be able to do that. So for the first time, we've been able to do what we hope to do at the very onset of the Hazardous Weather Task Force. I had the pleasure of being at one of the first meetings as a provider, and now I get to facilitate these meetings. It's a great group of people, it's action-oriented, and is effective at serving our people and citizens that are unhoused and unsheltered. So that's what's up with the Hazardous Weather Task Force, and I'd be glad to take any questions from you.
Commissioner?
Keep it up, Keely.
Thank you.
Commissioner?
We talked about this morning, but just for this audience benefit, so now with an annual contract, the triggering of opening up these spaces is based on a committee and the public health director, is that right?
Yes. So the Hazardous Weather Task Force is still meeting as stakeholders. They're shelter providers or other direct service providers, but also just concerned citizens that want to be involved. Anyone's welcome to those meetings. And if there's predicted to be adverse weather of whatever stripe, then the task force will convene, will consult with each other, and make a recommendation to the Director of Public Health. And the Director of Public Health and the Public Health Officer will determine whether or not to declare a hazardous weather event. Upon that declaration, then the Hazardous Weather Task Force will activate those extra efforts.
Giving us flexibility that a temperature number or a set of dates didn't give us.
Exactly.
Yeah.
And finally, we talked about this morning, but for the benefit of the folks watching and in the audience, where are we with the 5-year homelessness plan?
Yes, so the 5-year homeless crisis response plan is in final initial draft form, meaning the draft is completed and has been emailed and sent to Director Slaughter for her to look at and go over some of the final edits. When those come back to me, it'll return to we have a meeting with some of the core jurisdictions to look over the draft, and then also the core 5-year plan work group. That will be it's going to be made beautiful by Pam Gant, who's with TST at the county. And then the Board of County Commissioners will be briefed on that on September 12th.
Beautiful.
Mm-hmm.
Good, thank you.
You're welcome.
Anything else? No? Okay. Thank you, Keely,
Thank you.
very much. You're going to be busy for quite some time. This takes us to department item number 7, Climate Change Mitigation Plan and Thurston Thrives update. Chris.
Good afternoon, Commissioners.
Good afternoon.
Chris Hawkins. I'm a Program Manager in the Community Engagement Evidence and Partnerships section of the Health Department. Happy to be here with you this afternoon to update you on a project that is part of our Community Health Improvement Initiative, Thurston Thrives, here in Thurston County. And this is the climate and clean energy area of Thurston Thrives, but it's also an area of great interest across the community. So I want to cover a few basics about climate change and how it connects to health, because we are, after all, at a Board of Health meeting, and that's what we're here to talk about. So as you remember from discussions last year and really longer-term work than that, climate change is something that's happening in our community and around the world. And it relates to human activity. Basically, the greenhouse effect that occurs, as you can see in this slide, is a natural phenomenon, but it is something that's being accelerated and increased by the emissions of carbon dioxide from human activity. So you can see that turns into something that becomes a problem in the long run because it has some impacts to our local climate and climates in other parts of the world that begin to create some health problems. On this next graphic, you can see that climate change, as it starts to occur in our region, will mean that we have lower snowpack because of rising general air temperatures and temperatures on the land. We'll see more intense precipitation events in the wetter months of the year, but we'll also have prolonged drier summers. So what that means is during the winter months, we'll have more flooding. In the summer months, we'll have more prolonged drought and drying conditions. And what that gives rise to is a number of changes in the weather patterns for our part of the world. Again, those warmer temperatures will mean more heat events, more events where we have hazardous conditions in our community, both in terms of that heat, but also in terms of air quality. What that leads to is health challenges for people who have a health condition with their heart or their lungs, can exacerbate those health conditions. Also, a worse situation for people who have asthma or who have the precursors to asthma. Those heavier rains, again, predicted for our region, 5 more days of the heaviest kinds of rain events by the year 2080. That means that we'll have more flooding with the potential for contamination of food and water supplies, the stresses that go along with that, the disruption of services here in the county, including health services. And finally, sea level rise is anticipated as an impact from climate change. And that, again, has flooding impact and potential contamination impact. This also leads to, those changing conditions also lead to spread of different kinds of diseases or vectors for disease. So the warming climate means that certain vectors, such as mosquitoes, rodents, those can come further up into our part of the world and bring different kinds of diseases than we've been faced with before. So there's been a response going on to this in our community, and it's being made more acute by things like wildfire risk increasing and seeing more impacts from wildfire smoke, including fires that are occurring in our region, which is kind of unusual, at least in my experience here in Thurston County. And this is just a few images of that from the Scatter Creek fire in 2017. So there's things that require an acute response and need for services such as increased wildfires. But there's also a need to look at what's going to be coming in the future. And that led to our department being involved in setting up a work team around climate as an outgrowth of our environment action team in Thurston Thrives, which developed a strategy map to try to attend to these impacts of climate change and help to make our community more resilient, but also a main focus of this is to get ahead of those emissions, to try to prevent the emissions from happening so that our community is doing its part to keep the worst impacts from climate change from occurring. So we need to reduce those emissions as part of an overall effort that's happening around the world to reduce those emissions and hopefully prevent the worst impacts of climate change. This boils down that strategy map a little bit there, that next image, which shows just some of the main strategies that we're looking at, and that connects to what's known about the sources of emissions here in Thurston County, and I'll provide more detail on that in a moment. But it really comes down to changing the way our buildings use energy and what we do in transportation. Those are some of the bigger sources. And so that's being looked at now as part of an effort that's a climate mitigation plan that the county has entered into with other local partners. I wanted to talk quickly, though, about a couple of the things that have happened even before this climate mitigation plan to address climate change in the community. As a department, we've worked on this for over a decade, looking at some of those health impacts that I just mentioned. So we've been aware of climate change and its impact and its connection to health for quite some time. But this has also been worked on through things like Sustainable Thurston, which set a goal of carbon neutrality back in 2013. And then, as I mentioned, in around 2016, we formed that Climate and Clean Energy Work Group within Thurston Thrives that was really bringing together participants from a number of the action teams within Thurston Thrives. And that started to make this more of a public-private partnership, looking at what can be done to address climate change. Just as recently as the start of last year, the region passed a climate adaptation plan, which is an effort to look at how can we deal with those impacts that are anticipated and predicted for our region. So not so much the prevention part of responding to climate change, but we know that there are going to be some of these impacts. We need to do some things to prepare for that. Around that same time, Thurston Climate Action Team, which is one of the partners in that Climate and Clean Energy Work Group and quite active on climate change overall in the community, and a couple members of Thurston Climate Action are here with us today. Barb Scavese, I see out there in the audience, and Tom Crawford. They've been working really hard on this issue and have formed various work groups, but also put on a climate convention in the last several years. So that was trying to share what's known about climate change with a broader group of people and get people working on this. And then within the last year, you as commissioners have joined in this effort in a big way by signing on to an agreement to work together with cities of Lacey, Olympia, and Tumwater to do the climate mitigation plan, which is again trying to draw down those emissions in our region that our region is responsible for. So that's the big work that's coming up, and it's underway to look at how can we draw down those emissions in a scientifically based way. So your discussions last year of the climate mitigation plan set some targets that were based on the data that we have available locally. So using 2015 as a baseline year, we're going to look at how we can reduce our emissions from these various sources in Thurston County to 45% below 2015 levels by the year 2030, which is just over 10 years away. And then by 2050 to reduce them by 85% below those 2015 levels. And this graphic here shows some of where this is at. The far left side of it shows a little graph of where our emissions have been at the top left corner there, and unfortunately going in sort of the wrong direction, and the targeted reductions shown on the right side of that graph. So job one is done, the emissions targets are set, but now the heavy lifting begins of really digging in on this plan, which is now in its public engagement phase. The project is really trying to get out and meet with people in the community and gather their ideas and suggestions for what actions will be effective on driving down our emissions, as well as helping prioritize those actions. The project has also formed a steering committee that commissioners are participating in, as well as other elected officials who are the decision makers for that climate mitigation plan project. There's also a climate advisory work group that has been formed to help this process along and kind of gather the best ideas from experts in the community related to energy and climate change. And those things are going to be brought together in a final plan by a little less than a year from now, is what we're expecting. I wanted to show you a little bit of the data that lies behind this. This is data that was gathered by Thurston Climate Action Team. They have been doing an emissions inventory. And this shows you where some of the biggest sources of our emissions are here in the Thurston region. Again, it's largely from buildings, and a lot of that is from the use of electricity in home heating and lighting and cooling. And then there's transportation, with a large share of that being personal automobiles and transportation. I should point out that in 2017, which is the last line of data there, our emissions were up higher than 2015 levels by about 11%. So we've been trending upwards. We have some work to do. This graph is based on that 2017 data, and it's just another view of that same information of where our emissions are coming from. And as you can see, a large part of that built environment emissions, which is 3/5 of our total emissions, is from residential or the housing that we have in our community. And then for transportation, roughly 3/4 of it is from personal transportation or passenger vehicles. So you might ask, why aren't we doing something sooner? This is an urgent issue, and we need to take action. And in fact, local jurisdictions are taking action to address this even before the plan is done. They're figuring out ways to reduce emissions. And actually, I have one of the members of the Climate and Clean Energy Work Group, Cynthia Pratt, Deputy Mayor of the City of Lacey, is here to speak a little bit about what the City of Lacey is doing in the area of current actions to address climate-changing emissions. So Cynthia, would you please come up? Thanks very much.
So just to set the stage, since I was here from the beginning, and as a mother, so I have 2 kids. I nursed them. I read while I was nursing to them. So then, when they got a little older, we went out to the library. We got books. We read some more. We also did go out into our parks and open spaces and hiked and did things and talked about everything out there and what those plants look like and what trees look like. And then the kids both got excited, would want to go to the library, get more books, read more books, and then so they became really engaged in science and nature and what's out there. But my son does have and did have asthma. So picture you wanting to really engage your kids and have them be really appreciate nature and science and all of that. And we have smoke and bad air quality and flooding and heat waves, et cetera. It would make it harder for mothers to do that more and more down the future. So it doesn't pay to just wait till the plan is done. It really pays to start stepping up and doing something now. And so what Lacey has, not because of me, but in general, we've done a number of other things. And so we have had an EV station at our city hall for a while, but it was old, and we replaced it with a level 2, 4 level 2 EV stations. They're quite often fully used. We've done LED traffic signal change out so that our traffic signals are LED. And then we have also replaced, as we go along, several of our street lights, 34% into LED lighting. And when we're done, we will have reduced our electric usage by 58%. We've completed a number of energy service types of projects at our municipal buildings, just working through it. And how we did that is the Department of Commerce gives grants out and loans and does an inventory of your buildings. And they then give you an idea of what you can do for X amount of money and stuff. And we followed through with that. And so we're saving money because our buildings are now more energy efficient, our city buildings. And then we've also changed our building codes. So they have to be solar ready. A residential has to be solar ready. And what I hadn't realized is that when you build a building, it doesn't make sure that the roof can hold solar panels. Well, if you put that in your building codes to make sure that it is able to do that, then that gives them the incentive to say, well, I can then put solar on my residential house, kind of thing. The city also meets enough requirements of the Soul City Communities Program guidelines to qualify as a solar smart community. And so we've kind of worked our way up to be able to do that. Now, are we done? Of course not. We're doing another 11 EV charging stations at 4 different locations, and some of them are fast charging or level 3, and some are just level 2 and level 1, but at least if you're shopping or something, you can plug your car in and run out, and it will charge as you are shopping. And then we're also discussing with the Olympia Community Solar on a potential community solar site, such as our new museum or one of our maintenance shop buildings. And so I think it behooves cities and the county to think about what can they keep doing while we get a plan, because our plan is going to be probably more regional, more bigger ideas, But if you're going to, if your bulb street light runs out, goes out, you might as well replace it with a LED light. It's that simple. So thank you.
Thank you, Deputy Mayor.
Thank you very much, Cynthia. And so just a couple other things I wanted to quickly mention in terms of early actions. I know the county has been considering some of these as well, and it's part of the county's strategic plan to work on supporting environmental health and climate stabilization. So I want to acknowledge that the county has made that one of its strategic plan initiatives, which is wonderful and part of this ongoing effort. So the final thing I wanted to say was that in addition to local government actions, which make a difference on this, there's also the private sector stepping up. Thurston Climate Action Team continues to work on this issue across a number of organizations in the community. And then there's the private sector starting to do more on clean energy projects. An example of that being Olympia Community Solar, a new nonprofit that is trying to encourage those community solar projects here in Thurston County. So with that, just want to conclude by saying that this is a big issue. It's one that requires effort across multiple sectors, and the collective impact efforts of Thurston Thrives are perfectly suited to try to help bring that about, as is this climate mitigation plan, which is really trying to address community-wide what can we do to address emissions. That project is going on right now. It does have a public engagement process going on, so people, if they want more information, can go to this website. It's Thurston Regional Planning Council's website, trpc.org, and then just /climate. And there's information about the project there, and also a survey that people can take to provide their input and share their ideas. Allison Osterberg is here from Thurston Regional Planning Council. And she is the coordinator of this project for TRPC, which is managing that effort. She happens to have a fact sheet or an information sheet about the project that she can pass out to folks here in the room as well as to the commissioners, although I think this is already part of your packet electronically. So definitely very much appreciate your time and look forward to continued effort on this and what we can accomplish together.
Questions, comments?
I don't know if we want to get into it here. I'd like to hear a little more about the charging stations and solar-ready roofs, just to see if there isn't. That sounds like maybe a lighter lift, but we have a hard time making the heavy lift because really when growth management was put in place, they never put in phase 2. That was to help counties be able to handle all that growth and properly handle it and maintain open spaces and move ahead. I hate to use this when Cynthia's here, but I mean, and because they didn't put phase 2 in for us to deal with that stuff, Lacey's got 38 people on the Parks Department, and we have 4. Yeah, we're kind of up against that when it comes. A lot of people don't realize how stretched we are at the local government level here. And it's because there was a mistake made. And I know the Ruckle House study from the legislature is hoping to come up with something to help us to address some of these shortfalls so that we can kind of get on board.
Cynthia, do you want to address the electric vehicle? Were you asking about the electric vehicle charging?
I mean, I don't know how far we want to go into this.
I think the county already has some of these spaces at some of its facilities.
Things like credit. How do you do it with a credit card? How do you conduct the billing? Is it a monumental task to get the bookkeeping right? And,
you just asked a bunch of radical questions.
I know. I'm interested. I don't know if we have time to do it right now.
Well, you might not, but remember, building codes is just a policy decision, changing your building code, so you can do that. The other thing is, it depends what kind of charging station. Like down at Olympia City Hall, I believe you pay for it. And there's at Lot, you have to, a charge point card that you pay for. So really it's not weighted against local or county government. However, at our charging stations at City Hall, they're free, but they're not fast charging. So it's a little less, but, you know, you just plug it in and
Well, I'm sure we couldn't have anything free, but.
But maybe
Hey,
a
I
separate-
I
maybe a
love
separate
free
item
free
on our
chargers,
next BOH.
believe me.
Yeah, sometime.
Having a Volt, so.
Thank
And
you, Deputy Mayor.
I know Tenino, you know, put on, they're really into it with their schools, having the charging on the
And solar,
roofs, and
yep.
solar charging and
Yeah.
stuff, so. And I know they got some grant money. There are some ways to do some things, so it'll be interesting. So we'll-
Commissioner?
Thank you for kind of going through that list, Deputy Mayor Pratt, because, you know, things that might seem like a difficult, like the roofs, for example, that might seem controversial or difficult, but when we know Lacey's doing it, then obviously the builders in our community are going to have to be familiar with that, and we can coordinate by working together. We can do things that will, I think, make it easier for people rather than having a patchwork of different sets of rules and different approaches. So I'm all for that.
Remember, you save money as well, as you do something.
So thank you. We have very limited time to a very limited timeline to mitigate the most serious effects, as you've laid out, Chris. So what this shows to me, this slide, is, you know, we've known at least for 10 years, because we have a 10-year list here of a project, identifying a goal, establishing a work team, developing an adaptation plan, agreeing to work together. I mean, we're at the point where we need to shift to action, and I'm hoping that we can all of our jurisdictions can join hands and be all in when we get our mitigation plan sorted through. So thank you.
And Chris, as you said, a lot of this is human caused and can be human mitigated. And so I go back to Smokey the Bear. It was Smokey the Bear 75 years ago in 1944 when he was born. And the forest, of course, back then it was prevent forest fires. Now it's Smokey Bear. They took the out, Smokey Bear. And this is his 75th year birthday this year. But now it's wildfires, prevent wildfires. And so when you're talking about air quality and double the area burned by wildfire in Washington by 2040, everything comes together. Everything that touches this issue and every other issue. Because here's an article from NPR, how the Smokey Bear effect led to raging wildfires. This is from 2012. This last Sunday morning, I woke up to NPR, and they were talking about the Smokey Bear effect on wildfires, because when the U.S. Forest Service came into being, they said, hey, stop all fires. It used to be the settlers would come in and with their cattle and whatnot, and they would eat up all the junk in the woods. Now it's all left to stay, leave it natural, and it's causing greater wildfires, out of control wildfires. Now, I'm not saying we have nothing to do with that. You know, we can't mitigate that. But all these other little things that we do, thinking we're doing real good, we're not doing real well, which is kind of interesting. But very fascinating. We're on board with this as a county, and we're going to move forward to support you.
Thank you.
And working with the cities, too. Thank you, Deputy Mayor. Now, where were we? So that takes us to agenda item number 8, which is the, us talking about health-related stuff that we've been involved in the last week or two.
Well,
we
I'll
last
just say
met.
Smokey the Bear, when he was first come on the scene, he was my teddy bear.
He was, was he? That's why I call you Gare Bear.
Anyway, no, all good work. If I've got anything that I'm working from a health perspective, it's been clean water, but I'm going to let that go at this point in time and hear what kind of a report we've got from our director and our doctor.
Do you have anything you'd like to report on?
We haven't had a Board of Health meeting since mid-June. And in late June, I attended the Washington State Behavioral Health Conference in Vancouver. And I got to attend one day of it to see our True Blood presentation and also learn as much as I could from the other presentations. But that's the only specifically health-related activity I've had since the last meeting.
And
other than water issues, as Gary mentioned.
And so it's public health and social service involvement. And what I'd like to add is, since July 2nd, I've had 2 deaths in the family. So I've been dealing with the social services portion of it with doctors, coroner, hospice, nurses, law enforcement, support systems like caretakers and such, and home caretakers and such, and it just boggles the mind how many folks out there care. They care, and they work with individuals, they work with families, and it's just overwhelming. And I know that happens here locally, and this was in California and in Kennewick. You folks are everywhere, and so I'm happy. It makes me very content and happy. That's it. So, health officers report.
Hello.
Hello, doctor.
Am I on? Yes, I think I am. So I want to take this opportunity to let the public know that it may be a good thing that we've had some rain lately because it's keeping the underbrush and our trees and lawns more moist. We do have concerns that there will be wildfire smoke affecting the air quality for all of us in the weeks and at least through September until the autumn rains come. So I wanted people to know that they need to stay informed about what the air quality is. There's ways to do that. You can go to Air Now, or you can go to the Washington State Department of Health website and see smoke from wood fires. Just search within the Washington State Department of Health. Also, if you have an iPhone, you may, if you go to the weather app, I guess, I'm not an app person, but you can see the temperature and the time, and you scroll down, you'll see a determination of what the air quality is. So you can, if you have a phone, you can look on your phone and see what the air quality is. But steps to protect the public from smoke are stay informed about air quality, limit exposure if it's starting to climb up into the hazardous. Actually, we move from good to moderate to unhealthy, and then very unhealthy, and then hazardous. So please be aware that if the air quality is starting to be not as good as we'd all like it to be, if you have problems with your breathing already, you might consider visiting friends in a more a place with better air quality. But if you are staying here, avoid strenuous outdoor activity, limit time out of doors, and when you stay indoors, you want to keep your indoor air clean, keep windows and doors closed, and if you feel that you need to clean your home or the place where you are staying, use a wet mop. Don't vacuum because it makes dust get up into the air. Set your air conditioning to recirculate so that you don't suck in air from the outside. That's poor air quality. And if possible, use an air cleaner with a HEPA filter, H-E-P-A. Not sure what that stands for, but that's what we recommend, a HEPA filter. And pay attention to your symptoms. If you're noticing that you're struggling to breathe and you have burning eyes and sore throat, I advise you to seek medical care. So that's one issue I wanted just to inform the public about. The other is I'm very grateful for the program today on immunizations and the proclamation. I am still getting calls from medical providers with individuals with a fever and a rash illness. And on occasion, since the last Board of Health, spent some time being very concerned. An individual between the ages of 0 and 10 who was not immunized happened to expose in this state individuals who were immune compromised. This was all inadvertent, and we spent a very tense 5 days getting tests to see if the rash illness was from measles or not. Most fortunately, it was not from measles. But it's just an ever-present reminder that there are people who cannot get vaccinated, that if they are exposed to measles and get it, they could die. Please make sure your measles, mumps, and rubella vaccinations are up to date. And I will stop there, but I'm happy to answer any questions. Thank you.
Questions?
No, I don't have any questions. Thank you for what you're doing.
Any questions? No. Nope. Thank you, Doc. Again, thank you very much. Director's report.
Good evening now, commissioners. I just want to say thank you again to all of our amazing staff and community partners who highlighted the great work that's happening to improve the health and well-being of our community and to protect our environment. Last month, I had the honor of attending the National Association of City and County Public Health Officials annual conference in Orlando, and the theme was improving the nation's health through public and private partnerships, and specifically around promoting social determinants of health. And it's always great to get that national perspective on the amazing work that we're doing and the actions that we're taking here, because I can say that this meeting, this Board of Health meeting today, really highlights how Thurston County is cutting edge in this way. And I want to also echo some of the comments that Deputy Mayor Pratt said about how not only is this so important for our community, but in fact it impacts all of our lives. And my kids also got their first books from South Sound Reading Foundation and got childcare through the Child Care Action Council, and I got breastfeeding support. And so it's so great to see those partners here and to see so many volunteers in our community committed to promoting health and preventing disease and other adverse health impacts. Last year, I had also the privilege to attend some of the back to school events and clinics. And so I just want to again reiterate to our viewing public what an amazing opportunity that is and share some specific details. I know it is included in the reference materials online and the flyers are distributed throughout the community, but just to share the dates again, Thursday, August 15th, from 8 a.m. to 4 p.m. The Little Red Schoolhouse will be at Camachin Middle School over in Lacey. Thursday, August 22nd, from 4 to 8 p.m. at Peter G. Schmidt Elementary is another event, followed by Saturday, September 21st, from 9 a.m. to 12 p.m. at Kaiser Permanente Olympia Medical Center. As Dr. Wood shared in the agenda setting that we had this morning, this schedule also allows for kids to get both doses that they need for the MMR vaccine. So I also wanted to share a little bit more about some news around that. The Washington State Department of Health is collaborating with Safeway and the Department of Children, Youth, and Families to offer no-cost measles, mumps, and rubella, that's the MMR vaccination, for uninsured child care workers and volunteers. And as of July 28th, the Washington state law does require that staff and volunteers of licensed child care centers are immunized against measles. And so those are free locally at our Safeway pharmacy on Harrison Avenue in West Olympia. So I wanted to share that. Also related to both the importance of immunizations and related to our homeless and affordable housing coordinator's report today is that some people may have heard that the Washington State Department of Health announced an outbreak of hepatitis A within Washington State recently. And our department sent out a notice to health care providers to be aware of this outbreak and advise the public on some things that they can do to prevent hepatitis A in our community. Multiple states across the country have reported outbreaks of hepatitis A, primarily among people experiencing homelessness and persons who use illicit drugs. The rates of hospitalizations are much higher in this population because of the chronic diseases that many of these individuals experience and the higher risks and vulnerabilities that they have.
And there are severe complications, including liver failure and death. So it's really important that we're taking preventative measures. So our staff are working together to find ways in which we can mitigate these impacts by providing greater access to hepatitis A vaccine, which is the #1 way to prevent it, and also to ensure that people who are unsheltered or in crowded living conditions have access to proper sanitation, including hand washing. So that's really important. You heard a lot from our Child, Family, and Community Wellness program today about maternal child health, and specifically around breastfeeding rates and immunization rates and how we fare compared to the rest of the state of Washington and nationally. And our staff recently, specifically Gretchen Toller, our maternal child health manager, and our special health care needs nurse Bonnie Peterson, worked on a maternal child health needs assessment for the Thurston County Department of Health, and looked at our local data and identified areas in which we're not doing as well as we would like to be in Thurston County, and that helps us to prioritize areas that we need to focus. So areas that we need to improve on include immunization rates, or breastfeeding initiation and continuation rates, smoking in the 3rd trimester, access to early prenatal care, infant mortality, child abuse and neglect, teen suicide and children's mental health, housing insecurity, and equity. In all of these areas, there are great disparities amongst different populations and areas within our county, and that really helps us to guide our own strategic planning and look at our community health needs and how we, as a department and as a Board of Health, can take these as opportunities to do even better for kids in our community. We heard about climate change and the impacts, and one of the ways in which you heard highlighted was impacts on our water quality. And I'm happy to announce and credit the amazing work of our environmental health water quality staff for working on the annual 2017-2018 Streams Water Quality Report, which is available online on our Thurston County website for those that are interested in more details. Our staff, with funding from the Stormwater Program, monitored water quality at 33 sites across the county. Again, this was in 2017 and 2018, and found that based upon the Water Quality Index, 73% or 24 sites were classified as moderate concern, 9% or 7 sites were low concern, and 6% or 2 sites were high concern. Many streams have water that's warmer than the standard set to protect salmon, and warmer water holds less oxygen. 58% of the sites classified as core summer habitat for salmon did not meet that oxygen standard. So more information to come on that, but I just wanted to draw that connection between some of the information that you heard today about climate change and how important it is to be proactive and direct the public to view that great report. Finally, just a thank you again to the amazing staff that we have and the work they do every day. Our communicable disease team investigated and followed up on confirmed and suspect cases of over 20 notifiable conditions. And our syringe services program collected almost 900,000 syringes through the 25th of July. You heard at a local or at a recent Board of County Commissioners meeting the introduction of a new opioid response coordinator that is helping to implement the opioid response plan that you approved last month, and we're really excited about that. And that we have opportunities to dispense more doses of naloxone. We have distributed over 1,500 this year so far, and so that is literally saving lives. And I think that concludes my report today. There's lots of other great things our department is doing, and for anyone that's interested in more information, check out our website, check out our social media accounts, Facebook, Instagram, and Twitter.
Public health does not slow down.
There's never a dull moment for us.
Thank you, Director Slaughter.
Thank you very much.
Anything for the good of the order from my seatmates?
I just want to thank everybody that came today and participated.
Anything?
Nope.
Allison, it's nice to see you back in the house. And with nothing further, then this BoH meeting of August 13, 2019 is adjourned.
Thank you.